Many clinicians underestimate the percentage of women who may be affected by sexual dysfunction. They're probably more attuned to male sexual dysfunction because we have a lot of products to treat it and because we've been talking about it for a number of years. So I think that they underestimate it, and I think that when they recognize it, and many clinicians are uncomfortable talking about it, they're really not aware of potential interventions that could benefit women with sexual dysfunction.
Common misunderstandings for clinicians about female sexual dysfunction is that women are not interested in sex, and when they get older they don't want to have sex, and that there's nothing we can help them with. So I think in order to prevent this misunderstanding, it's very important to talk to the women about their sexuality.
So I think that most clinicians, when it comes to female sexual medicine, don't know that there's any treatment options available for their patients. I don't think it's that clinicians don't care about sex. That's a misunderstanding. I think they do, but it's very hard in a clinical setting to treat somebody if you don't know what the available treatment options are, and that's going to prevent you from asking a question because you don't want to open a Pandora's box that you can't get yourself out of. So I think that the lack of understanding of the types of treatment options out there, as well as the different types of diagnoses that are not that hard to discover or figure out with just a little bit of experience and education, are probably the most common misconceptions.
There are so many misunderstandings among clinicians about sexual dysfunctions in women. A lot of that is because when your provider went to medical school and through residency, we really knew very little about sexual dysfunction in women other than it being a psychologic problem. And to this day, there are physicians who say, oh, you have a problem, have some chocolate, have a glass of wine, give the kids to your parents and go away for the weekend. Well, don't you think women have tried that already before they've shown up at your doorstep? That's not going to solve something if it's a biologic problem.
The most common misunderstanding for female sexual dysfunction for clinicians is that we have nothing available for our patients. We have a huge toolbox available, and that toolbox is growing all the time. I use so much of what I know as a urologist for my male patients, and we're able to help many female patients. We have FDA-approved drugs for low desire or hypoactive sexual desire disorder. We have so many options available to help people who have sexual pain conditions. And so there is so much that we can do to help our patients, and oftentimes people say, well, I didn't learn how to do this in medical school or in residency, and so I cannot do it. And really, it's everyone can learn new things and can learn how to help female patients with their sexual problems.
If you don't know how to treat it, that's okay. But don't be afraid to admit, I don't know what to do. I'm going to refer you to somebody else. I'm going to learn about it and bring you back because it's an important discussion. Let's talk about it later. But to just assume that it's a relationship issue, that she needs a new partner, that has no value to anybody.